Imagine waking up to a world where cutting-edge weight loss medications, once a luxury only the wealthiest could afford, become accessible at a fraction of the price, potentially transforming millions of lives. That's the bold promise behind the recent agreement struck by the Trump administration with pharmaceutical giants Novo Nordisk and Eli Lilly, aimed at slashing costs for their popular GLP-1 weight loss drugs in exchange for expanded Medicare coverage. But here's where it gets controversial. Is this a win for public health, or just another political maneuver that could burden taxpayers? Let's dive in and unpack the details, breaking it down step by step so even newcomers to this topic can follow along easily. On Thursday, the Trump administration revealed they've brokered deals with Eli Lilly and Novo Nordisk to reduce the prices of select GLP-1 medications used for weight management. These are injectable drugs that mimic a hormone to help regulate appetite and blood sugar, revolutionizing treatments for obesity and related conditions like diabetes. In return, the companies gain partial Medicare coverage, unlocking fresh opportunities in the American market. It's a classic give and take in the world of healthcare negotiations, where lower prices pave the way for wider access. Think about it. Right now, Novo Nordisk's Ozempic and Wegovy, along with Lilly's Zepbound and Mounjaro, carry a list price of roughly $1,000 each month before any discounts or rebates kick in. That's up to 3 times what people in other advanced countries pay, highlighting the stark disparities in global drug pricing. Starting next year, though, these medications will be available through the new direct-to-consumer portal called TrumpRx at an introductory rate of about $350. This isn't some distant dream. Consumers can already snag this deal directly from the manufacturers' websites today. And this is the part most people miss. Over the next couple of years, prices on TrumpRx are slated to drop even further, down to $245 per month, as reported by Axios. Shifting gears to Medicare, the federal health insurance program catering to folks aged 65 and up. A Trump official elaborated that a pilot program kicking off in mid-2026 will extend coverage to roughly 10% of beneficiaries. Picture this: for those eligible, the drugs will cost $245 through Medicare, with patients shelling out just a $50 copay monthly. State Medicaid programs have the option to join in at the same low price, broadening the safety net for lower-income groups. But here's a potential flashpoint for debate. Medicare traditionally covers GLP-1 drugs only for diabetes or heart conditions, not obesity. With 66 million enrolled in Medicare and the Congressional Budget Office estimating 12.5 million could qualify for these meds if obesity treatment were included in 2024, this expansion could ignite a surge in prescriptions. Indeed, these drugs are skyrocketing in popularity, becoming one of the most prescribed worldwide just 4 years after hitting the market, rivaling stalwarts like statins for cholesterol. Morgan Stanley research predicts the global obesity drug sector could balloon to $150 billion by 2035, up from a mere $15 billion last year. To put that in perspective, consider how these medications aren't just about shedding pounds, they've been linked to improved heart health and reduced diabetes risks, offering a holistic approach to wellness that could prevent costly complications down the line. Yet, this move isn't without its backstory. The Biden administration had introduced a rule in January broadening Medicare and Medicaid to cover obesity treatments, but the Trump team paused those efforts in April, citing excessive costs. Then, in July, the Trump administration penned letters to 17 major drug makers, including Novo and Lilly, urging them to align U.S. prescription prices with the cheapest rates in other developed nations, a tactic known as the most favored nation pricing. Pfizer and AstraZeneca have already inked similar bargains, lowering their drug costs in exchange for tariff breaks, setting a precedent for these negotiations. As for market reactions, Lilly's stock edged up nearly 1% by midday Eastern Time, while Novo's dipped about 2%, perhaps reflecting investor jitters over profitability amid these price concessions. And this is where opinions might sharply divide. On one hand, advocates cheer the accessibility for millions battling obesity, potentially reducing long-term healthcare burdens. On the other, Critics argue this could strain government coffers or question whether drug companies are being fairly compensated, raising ethical quandaries about pharmaceutical profits versus public good. Are these deals a savvy win for American consumers, or a slippery slope toward government overreach in pricing? What do you think? Do these agreements represent a breakthrough in affordable healthcare, or are there hidden downsides we're overlooking? Share your thoughts in the comments. Do you agree with the price cuts, or fear they might stifle innovation in drug development? Your perspective could spark some lively debate.